I think our view is essentially that it's inevitable that we'll move forward with an electronic transition and that it will be vital to healthcare delivery and improvement. But we have a lot of concerns about how this is actually implemented, wanting to make sure that the policies are integrated along with the technology.
What's your main concern? We mentioned privacy. Is that the main one?
It's privacy, confidentiality, appropriate data use. I mean, we acknowledge that the information is going to have to be shared, but we want there to be certain rules and protocols for how it can be used and shared, and only when the patient or their family wants that to happen.
So to boil it down, it's sort of like an ATM on steroids, right? I mean, if I worry about my ATM card or identity getting stolen, my medical records would be potentially even worse and certainly a lot more private.
It is, and consumers have a much higher degree of sensitivity with respect to their medical information than financial information, in part because we don't have a lot of the safeguards in our system protecting health information.
But why isn't it mostly, like 95%, a great thing? Because if you talk about protecting me, the most basic protection is that when I go to the doctor, he doesn't screw up my medical records and give me the wrong medication. He can pull everything up, or she can pull everything up and see what I'm all about.
I think that is certainly a laudable goal, and I as a patient would want to see that, but there are a lot of concerns about what else that information could be used for. So right now we allow discrimination for employment, for health insurance coverage. People are really concerned that their health information could be turned and used against them, and there have been several cases of that.
Give us an example of, if there is one at the top of your head, of a concern, of a case where someone's medical records weren't properly guarded.
The mechanism to track that right now rests with the Office of Civil Rights, which is part of Health and Human Services, and there's been, I think, 24,000 reports, and not one single violation or penalty has been assessed. So
reports of what? Of what happening?
Well, it's a mixed bag. So if your data has been misused, or if they think there's a violation or breach of the Health Information Portability and Accountability Act.
And let's figure out when you say my data, what's my data?
It could be anything. So one really touching example is a woman whose mental health information was sent along with the entirety of her medical record, and that piece of it didn't need to go to get the care that she needed. And now she is completely unable to get that piece removed from her medical record. So every time that medical record gets shared with another institution, they also have her mental health history.
And she doesn't want that?
She doesn't want it. She's tried. There was an article in the Wall Street Journal a couple months ago about her, and she's tried every means of recourse she has, and she can't get anybody to change it in the system, in part because the law affords her no protection and no recourse.